commodity prices are likely to rise.
If you have one round of COVID, you're okay for 3 months.
India's pressing needs are being utilized by Chinese manufacturers.
How badly will India's economic prospects be hit because of the second COVID wave?
On the economic side, so to say, we maybe have certain sectors which are good and will continue to do. Steel is doing fantastic, the prices are too high. Cement is doing very well, the prices have gone up. All these things, some sectors are definitely doing well. But there is so much unemployment, and there are sectors like travel, tourism, hospitality, the small MSE workers and workforce. I think the government will have to come up with a kind of a package which they did last time.
It's not that we are saying the economy will contract, because currently we don't have a nationwide lockdown. While there are many local lockdowns, there are restrictions, and that is impacting the economy, and it is because of that impact that growth projections are being cut.
MSME sector, which had become vulnerable during first wave, is again taking the brunt of second wave. Now, at this point of time, markets are discounting that with vaccination, we will be able to contain COVID-19. With COVID appropriate behavior, we will be able to contain impacts of COVID-19. We will be able to kind of do regional and rotational lockdown and avoid national lockdown to reduce the impact of second wave on economic activities.
How long do you, in your estimate, is the shadow going to be, and how much do you see the second wave drag down India's growth prospects?
The economy is sort of on oxygen. The informal sector is probably in the ICU, and the MSMEs are experiencing mild symptoms too. Some of them are probably on the ventilator. The issue that we face now is that in the last wave, the rural economy stood by and provided some sort of buffer. This time that has been hit.
I think the peak is going to be there probably somewhere around June, and then it might abate, but it will abate very slowly, and I think we are going to be into October, November before we can really think of opening up our economy. So capital flow out might take place, and what will happen is commodity prices are likely to rise. So in a situation where we are already facing trouble, if commodity prices rise outside, that will worsen the situation for us. And if capital flight takes place from the economy, that will further worsen the situation.
The government has now said have a 12 to 16 week gap between Covishield jabs. Will it make any difference?
Let me reassure everybody who has taken it at 4, 6 or 8 week intervals, there's no problem. As time goes by, more and more data is accumulated, and they've found that antibodies are still present after 12 weeks. So if you took a second shot, say at 16 weeks, it'll work as a booster. So if they want to increase the gap from 12 to 16, let them do that.
If I take one dose and then get the virus after a couple of weeks, how much can I postpone my second dose for?
If you have one round of COVID, you're okay for 3 months. So you have at least a 3-month period cushion to take the vaccine. If you've already had one dose of the vaccine and you've had COVID, it's very possible that the COVID acts as the booster to the first vaccine itself. So you may have a little more than just 3 months. So I could model it and say maybe 6 months is okay.
Should the babies at any stage, any precautions for them?
The first thing is the parents should get vaccinated, and that'll protect them, and in that way they protect the children. Second, the advisories come in about vaccinating pregnant ladies. There's a clear advisory of vaccinating mothers who are feeding. Vaccination for children is essential. It's just going to take a bit of time.
Can a 6-minute walk test help identifying early stage pneumonia among patients being treated at home?
When you walk, your body needs more oxygen. And if your lungs are affected enough, the lungs will not be able to provide that increased quantum of oxygen that the blood requires. So a 6-minute walk test could pick up signs of deterioration at a slightly early stage. It's not necessarily been validated that because a 6-minute walk test is showing a drop in oxygen saturation, therefore you need to do something differently. I would keep the person under a closer watch, under a closer radar. Unless the patient clearly looks like he or she is deteriorating, I wouldn't be in a rush to start steroids purely based on a 6-minute walk test.
It's the drop in quality
from medical grade equipment to substandard equipment, that's a cause for very serious concern.
Because of the increase in demand, there are certain components that are not available. And if they're not available, then the manufacturers should make that very clear and should show what exactly the changes are in the new concentrators that are being sent. That there is no full disclosure on that front, and that really has brought down the life cycle of concentrators to what it used to be, which is a couple of thousands of hours, to substantially less, to a couple of hundreds of hours.
Mr. Tangen, this is not just unfortunate, this is unethical. Are there no quality controls in China?
There's a difference between Chinese government, which has donated 100 standard oxygen concentrators and also 40 respirators, plus $1 million through the Red Cross. From Beijing's point of view, they have been trying to reach across the divide, but they've been rebuffed. So from their perspective, the private side, who a lot of Indian businesses, hospitals, etc., are buying from, they're not, quote, regulated. And it's not just India that has a demand for these. And I think if these people are doing this, it's unscrupulous. But you can understand that supply and demand works. And the Chinese government does not have the ability to go in and say nothing can be exported unless you, do these things and those things. This is an instant pandemic.
Gaurav, this is a very disturbing story to me, because the life of a COVID patient is dependent upon certain equipments, may it be oxygen concentrators or ventilators or CPAP or BiPAP machines. So we cannot expect them to be of any kind of substandard equipment.
India's pressing needs are being utilized by Chinese manufacturers to engage in price gouging, and worse, as we have been hearing, in supplying substandard quality stuff, which is playing with the lives of people in India. So India is facing a double whammy at the moment. It's paying through its nose and getting substandard quality stuff that is putting at risk Indian lives.